Hey, I'm Adam with the Pursuit Counseling. Today, I want to talk with you about something that's very important in my life as a person, but also as a therapist, which is the mind gut connection. Did you know that our mental health and our digestive systems are intertwined? For those struggling with anxiety, stress, or other mental health issues, this connection can manifest in physical symptoms that can complicate our overall well being. There is a bidirectional communication between our brain and our gut. Remember, the vagus nerve runs across here, and that is part of what connects our mind and our gut. Hormonal influences, immune responses, and there's a microbiome, which is really a big way of saying trillions of bacteria that influences our brain function and our mood through the production of neurotransmitters like serotonin. So there is a big connection between our mind and our guts. As you can see, I have an article pulled up from the National Institute of Medicine. And this article was published in 2016. And I've got something highlighted here where it says previous studies have shown that depression and anxiety are risk factors for disease of the digestive system. The digestive system disease patients with depressive and anxiety disorders often have more serious somatic symptoms, longer time of disease recovery, and a worse prognosis. And therefore, they tend to consume more medical resources. On the other hand, several studies also show that the prevalence of depressive and anxiety disorders in patients with digestive systems is often high, and that those patients tend to visit the gastroenterology department of general hospitals because of more prominent digestive symptoms, mild depressive or anxiety symptoms, or even a concern of being labeled as mentally ill patients. So, as you can see, there is a connection or correlation between gastrointestinal health and depression and anxiety symptoms. I always enjoy bringing in research into the conversations that we have because I don't want to just be a talking head. Again, I'm a counselor in my profession, but these videos are really meant to be an educational tool, and they're not to be a replacement for therapy. So, what are some common symptoms of the mind gut interaction? Well, there can be some physical symptoms that arise from stress and anxiety, such as stomach pain, bloating, diarrhea, nausea, and changes in your appetite. These symptoms, they can create a feedback loop where physical discomforts lead to increased stress or vice versa. We hear about this often when people are performing on stage. Maybe they're giving a speech, a presentation. Maybe they're a pastor, a professional speaker, a professional athlete, and they're getting nervous, they're getting anxious, they're getting excited about what they have to do. And they might have some GI stress. Maybe they have diarrhea, or maybe they even vomit before going on stage and speaking or giving a performance. So that connection between that nervousness or excitement can reveal itself through gastrointestinal distress. I want to talk a little bit about effective communication with your healthcare providers. I think it's important for us to create a detailed symptom diary to track the type, frequency, and severity of our anxiety, depression, and our digestive distress. It's important to be specific in describing your symptoms to your doctors. And so you openly want to discuss your mental health and stress levels. What that might look like is instead of saying, I had a stomach ache, you can say, I have a sharp pain in the lower region of my stomach, and it showed up as diarrhea or it showed up as constipation. The more descriptive you can be, the better. Some helpful questions that you can ask your healthcare providers are, what type of diagnostic tests are done? Is it done through blood panels, upper GIs, lower GI tests, or ultrasounds or other not as invasive procedures? Also, ask your medical provider about dietary recommendations to help with your GI distress. And it's important to ask about stress management strategies from your therapist. Now, I want to discuss some holistic approaches to managing the mind gut connection. A lot of times, people don't want to go straight to asking for a referral to a gastroenterologist. If you want to try this on your own, there can be some benefits of having a balanced diet rich in fiber, fruits, vegetables, and even fermented foods. I want to put a disclaimer out that I am not a licensed or registered dietitian or nutritionist. I'm a licensed professional counselor in my career, and this video is meant for education purposes. There can be some benefits of having a balanced diet rich in fiber, fruits, vegetables, and fermented foods. It's also important to have regular exercise, mindfulness practices, and relaxation techniques such as meditation and deep breathing exercises. There are benefits of seeking therapy and counseling, as well as making sure you have good sleep hygiene and that you use probiotics and prebiotics. In our pursuit of being the best that we can be in life, it is important for us to take proactive steps in monitoring our systems of GI distress, anxiety, and depression. We want to communicate well with our healthcare providers and incorporate healthy lifestyle changes. By understanding and managing the mind gut connection, this can lead to significant improvements of your overall well being. So, if you're not talking with your therapist or doctor about your mind gut connection, I want to encourage you to do that at your next appointment. I'm Adam with the Pursuit Counseling. As always, it's an honor to add value to your life.